Bioresonance. Use frequency therapy and bring your body into harmony. Simply explains bioresonance. Bioresonance is an alternative medicine method based on the concept that the human body generates and receives electromagnetic vibrations. These vibrations, or frequencies, according to the theory, reflect a person's state of health and can be used to diagnose and treat illnesses. The method was developed in the 1970s by German physician Franz Morel and engineer Erich Rasch. Their goal was to create a technique that stimulates the body to regulate and balance itself by neutralizing harmful frequencies and strengthening positive vibrations. Bioresonance is fundamentally based on the idea that every cell, every organ, and every substance has its own frequency. These frequencies resonate with each other and form a finely tuned energetic field. If this field is disrupted, whether by external influences such as environmental toxins, stress, electrosmog, or internal problems such as inflammation, illness, or allergies, health problems can arise. Bioresonance therapy aims to identify and harmonize these disruptions. How bioresonance works. The basic idea of bioresonance is that the body as a whole forms an information field in which everything is interconnected. Information about the condition of the body and its organs is stored and transmitted in the form of electromagnetic signals. Using special bioresonance devices, these signals can be measured and analyzed. This determines whether frequencies are present in the body that indicate disturbances. During a treatment, the patient is connected to the bioresonance device via electrodes. These electrodes detect the body's own vibrations. The device analyzes these vibrations and filters out harmful frequencies to harmonize them. The corrected vibrations are then returned to the body to initiate the healing process. This is intended to enable the body to regulate itself and bring itself into balance. Bioresonance therapy is often described as a non-invasive and painless method. Unlike traditional treatment methods, it does not involve chemical substances or surgical interventions. This makes it particularly attractive for patients seeking gentle alternatives to conventional medicine. Applications of bioresonance. Bioresonance is used in practice to treat a wide variety of conditions and illnesses. These include allergies, chronic pain, digestive disorders, skin problems, sleep disorders, and even mental illnesses such as depression and anxiety. Bioresonance therapy is particularly well known for its success in treating allergies. By scanning the body's own vibrations, specific allergens that strain the immune system can often be identified. Another important area of application is detoxification of the body. Since many illnesses are caused or exacerbated by harmful substances and toxins in the body, bioresonance therapy attempts to neutralize these harmful frequencies and support the body in eliminating toxins. The body's own regulatory system plays a central role in this process, and the therapy aims to specifically activate it. Criticism and controversies. Despite its widespread use and popularity in naturopathy, bioresonance remains controversial in scientific medicine. Critics argue that there is insufficient scientific evidence for its effectiveness. In particular, they criticize the fact that the underlying theory of the body's electromagnetic vibrations and their influence on health has not yet been conclusively proven. Many studies on bioresonance are considered methodologically inadequate or produce contradictory results. Proponents of bioresonance, on the other hand, point to numerous positive testimonials from patients and therapists. They argue that many alternative healing methods have only recently received scientific recognition and that it may only be a matter of time before bioresonance also gains greater acceptance in scientific medicine. Conclusion. Bioresonance is a fascinating and controversial method that has been established in alternative medicine for decades. While scientific recognition is still pending, many people swear by its positive effects on a wide range of health issues. For patients seeking a gentle, non-invasive treatment method, bioresonance offers an interesting option that targets the body's self-healing powers. Whether it will gain wider acceptance in the long term remains to be seen, but its widespread use and practical application speak to the continued fascination and trust that many people place in this form of therapy. Origin and history of bioresonance. Bioresonance therapy has its roots in the 1970s and was developed by two pioneers of alternative medicine, Dr. Franz Morel, a German physician, and Erich Rasch, an engineer and technician. Together, they created the so-called Mora device, a technology based on the idea that the body generates electromagnetic vibrations and that these can be used for diagnosis and therapy. This device laid the foundation for modern bioresonance therapy. However, the foundation of bioresonance goes back to older concepts that are closely intertwined with traditional Chinese medicine TCM, homeopathy, and quantum physics. For centuries, TCM has held the idea that the body is crisscrossed by energy channels, called meridians, through which life energy, also known as qi, flows. Disturbances in these energy flows are considered the cause of illness, and restoring energetic balance is the goal of therapy. This idea of energetic health is also reflected in bioresonance therapy, which views the body as a network of vibrations and frequencies. Another influence came from homeopathy, particularly from Dr. Samuel Hahnemann, the founder of this healing method. He postulated that illnesses could be influenced not only by material substances, but also by immaterial forces. These forces, which he called dynamic disturbances, could be treated with minimal stimuli translated into vibrations. This is directly related to the basic idea of bioresonance, that certain vibrations and frequencies can influence a person's state of health. The actual development of bioresonance began when Dr. Franz Morel and Erich Rasch attempted to combine these different ideas. Dr. Morel was a dedicated homeopath seeking ways to improve the diagnosis and treatment of his patients. Rasch, on the other hand, was a technical genius who translated Morel's ideas into a device that could measure and modulate the body's own vibrations. Together, they developed the Mora device. The name is a combination of the initials of their surnames, which was first presented in 1977. The Mora device was revolutionary because it could not only record vibrations but also invert them. That is, negative or disease-causing vibrations were reversed and sent back to the body to neutralize the health problems. This theory sparked considerable interest in alternative medicine, and the Mora device quickly spread among alternative practitioners and naturopathic physicians. Over the following decades, the technology was further developed, and numerous variants of bioresonance devices came onto the market. Bioresonance gained particular popularity in Germany, Austria, and Switzerland, and was integrated into many therapists' practices. However, the method also became known internationally, especially in countries with a strong tradition of naturopathy and holistic medicine. Although bioresonance has gained widespread acceptance, it has not been without controversy. Critics, particularly from the conventional medical and scientific communities, have questioned the effectiveness of the method, emphasizing a lack of scientifically sound evidence. Nevertheless, bioresonance has been widely adopted in practice, as many patients have reported positive experiences, particularly in the treatment of chronic conditions that could not be successfully addressed with conventional medical approaches. In summary, bioresonance emerged from the synthesis of ancient, traditional healing approaches and modern technological developments. Its history demonstrates how the fusion of medical knowledge and technological advances led to the development of an alternative treatment method that, despite criticism, has endured for decades and continues to be used worldwide. Scientific background. The scientific background of bioresonance therapy is both fascinating and controversial, operating at the intersection of physics, biology, and alternative medicine. The basic idea is based on the assumption that the human body generates electromagnetic vibrations and that every cell, organ, and substance in the body possesses a specific frequency. These frequencies, according to the theory, resonate with each other and reflect the body's energetic balance. The foundations of bioresonance can be traced back to the findings of quantum physics and electrobiology. As early as the 20th century, it was recognized that all matter, including the human body, emits electromagnetic fields. This idea is supported by quantum field theory, which states that energy and matter are intertwined and that every particle possesses an energy packet or oscillation. With their research, German physicist Max Planck and Nobel Prize winner Albert Einstein laid the foundation for the understanding of electromagnetic waves and quantum mechanics, which also play a role in bioresonance. Bioresonance therapy is based on the assumption that illnesses or health disorders are the result of disturbed vibrations or frequencies in the body. These disturbances can be caused by internal or external influences such as environmental toxins, stress, radiation exposure, unhealthy diet, or emotional stress. The application of bioresonance aims to identify and harmonize these disturbed vibrations, allowing the body to activate its self-healing powers. An important aspect of bioresonance is the concept of resonance. Resonance occurs when a system responds to a specific frequency that corresponds to its natural frequency. In the context of bioresonance, this means that the body can respond to specific electromagnetic vibrations that either promote or disrupt its health. The therapy aims to neutralize harmful vibrations and amplify healthy frequencies. Although the theory of bioresonance has interesting connections to modern physics, its scientific basis is controversial. There is currently no broad consensus in the academic and medical communities regarding the effectiveness of the method. A major criticism is the lack of robust, double-blind, randomized studies that clearly demonstrate the effects of bioresonance. Many of the studies conducted are considered methodologically weak, and the results are often not reproducible. Proponents of bioresonance, however, argue that science has not yet been able to adequately measure or understand the body's subtle and complex vibrations. They point to empirical medicine and numerous positive feedback from patients who report significant improvements in their symptoms. Many alternative therapists therefore view bioresonance as a method based on subtle energetic processes that cannot yet be fully understood scientifically. Another interesting scientific approach supporting bioresonance is the idea of cell communication through electromagnetic signals. Cells communicate not only chemically via hormones and neurotransmitters, but also electrically via membrane potentials and bioelectric fields. These bioelectric signals could be influenced by external electromagnetic oscillations, potentially explaining the effectiveness of bioresonance. In summary, the scientific background of bioresonance remains a field that leaves many questions unanswered. While there are connections to modern physics and biology, clear evidence to support its effectiveness is lacking. Nevertheless, the method remains widely used in alternative medicine and valued by many patients, especially for conditions that conventional medicine can only inadequately treat. Basics of quantum physics and frequency therapy. Bioresonance therapy is strongly based on the principles of quantum physics and frequency therapy. These fields of science provide the theoretical basis for how electromagnetic vibrations and frequencies interact in the human body and potentially influence health. Quantum physics and its significance for bioresonance. Quantum physics is a branch of physics that deals with the smallest particles in the universe, such as atoms, electrons, and photons. Unlike classical physics, which deals with the motion and forces of objects in the macroscopic world, quantum physics investigates how these subatomic particles act. One of the central discoveries of quantum physics is that matter and energy are interconnected and that particles can behave both as matter and as waves, the so-called wave-particle duality principle. Bioresonance assumes that the human body consists not only of physical cells and organs, but also of a complex network of electromagnetic vibrations and frequencies. These vibrations are expressions of the energetic processes taking place at the quantum level. Every cell, organ, and substance in the body has a specific frequency, and these frequencies resonate with each other. When this resonant system is disrupted, whether by illness, environmental pollution, or emotional stresses, health problems can arise. Quantum physics also teaches us that energy is continuously exchanged in the form of quanta. In frequency therapy, and specifically in bioresonance, this idea is used to measure and modulate the body's own vibrations. The theory states that by emitting harmonic frequencies, the disturbed vibrations in the body can be restored to a healthy balance. Frequency therapy as the basis of bioresonance. Frequency therapy is the umbrella term for medical approaches that utilize electromagnetic vibrations to support healing processes. Frequency therapy is based on the assumption that every disease is represented by a specific frequency. This frequency can be measured and influenced using specific devices. Frequency therapy encompasses a variety of approaches, including Vol electroacupuncture, EV, magnetic field therapy, and the aforementioned bioresonance. Bioresonance therapy applies the theory of frequency therapy in a concrete way. Resonance plays a crucial role. When an organism responds to a specific frequency that corresponds to its natural frequency, a resonance occurs. The idea of bioresonance is to identify the pathological vibrations and, by mirroring or reversing them, stimulate the body to correct these disturbances. This method is based on the concept that the body has an energetic regulatory system that can be activated through proper frequency therapy. Frequency therapy also has its origins in the work of Nikola Tesla and Georges Lakhovsky, who discovered in the 1920s and 1930s that frequencies and electromagnetic fields can influence living organisms. Current research and application. Although the scientific validation of frequency therapy and bioresonance in conventional medicine remains controversial, there is a growing body of research examining the effects of electromagnetic fields on health. These studies explore how frequencies can influence processes such as cell division, gene expression, and metabolism at the cellular level. In practice, frequency therapy is used for a wide variety of conditions, from chronic pain and sleep disorders to stress and allergies. Frequency therapy is particularly valued in complementary and alternative medicine because it is considered non-invasive and gentle. Patients often report positive effects, although scientific confirmation of these subjective improvements is still lacking. In summary, quantum physics provides a theoretical foundation for bioresonance and frequency therapy. Although these concepts are difficult for many people to grasp, they are crucial to the functioning of bioresonance. Frequency therapy uses the insights of quantum physics to treat the body on an energetic level, thus representing an innovative and promising method with the potential to expand our understanding of health and healing. Energy fields of the body. The body's energy fields are a central concept in bioresonance and many other alternative healing methods. The idea that the human body consists not only of physical substances but also of energetic fields is deeply rooted in many traditional healing methods, such as traditional Chinese medicine TCM, Ayurveda, and chakra theory. The concept of energy fields. In bioresonance, the human body is viewed as a network of energy fields that interact with each other and are in constant communication. These fields are often referred to as the aura, biofield, or electromagnetic field. They are said to surround and permeate the physical body and serve as an information field that reflects the health and well-being of the individual. In modern physics, energy fields are considered invisible forces generated by electrical charges and electromagnetic waves. Similarly, the body's cells and organs are believed to generate such fields, which contain information about the body's state. These fields are not only an expression of biochemical metabolism but also a medium through which the body communicates and regulates itself in subtle ways. According to bioresonance theory, a person's energy field is influenced by various factors, including emotional states, environmental toxins, diet, and stress. These factors can disrupt the energetic balance and manifest as illnesses or ailments. The goal of bioresonance is to analyze this field to identify energetic blockages or disturbances and correct them through targeted vibrations. Energy fields in traditional medicine. The idea of energy fields is by no means new. In traditional Chinese medicine, we speak of qi, the life energy that flows through the body in meridians. If the flow of qi is disrupted, it can lead to illness. Similarly, the Indian Ayurvedic teachings describe the concept of prana, which circulates through subtle channels, nadis, in the body. In both systems, the goal of healing is to restore energetic balance. Another well-known concept is that of chakras, which originates from yoga and tantric teachings. Chakras are energy centers in the body that are believed to be responsible for various aspects of physical and emotional well-being. Blocked or imbalanced chakras are associated with various health problems. Measuring and influencing energy fields. A central aspect of bioresonance therapy is the measurement and manipulation of the body's energy fields. Electrodes and special devices that detect electromagnetic oscillations are used to determine the state of these fields. By analyzing the body's own frequencies, The bioresonance device can provide clues as to which areas of the body are energetically disturbed. The devices often work according to the principle of electrophysiology. They measure the electrical potential and conductivity of the skin, which are supposed to indicate energetic balance. The therapist can then use this data to provide targeted treatment by channeling specific frequencies back into the body to restore balance to the energy fields. Criticism and scientific research. Despite the widespread acceptance of energy fields in alternative medicine, skepticism persists in the scientific community. The existence of such fields is difficult to measure, and there are few scientifically recognized studies that confirm the theory of energy fields in the human body. Critics argue that many of the assumptions of bioresonance and energy field theory are based on speculative or pseudoscientific foundations. Nevertheless, there is a growing body of research investigating the interactions between electromagnetic fields and human health. These studies often focus on the effects of environmental stimuli such as electromagnetic radiation on the body and provide evidence that subtle fields may play a role in the regulation of biological processes. Bioelectrical phenomena and cell communication. Bioelectrical phenomena and cell communication are central aspects of bioresonance therapy and provide a scientific explanation for how this alternative healing method works. These phenomena refer to the way cells in the body use electrical signals to communicate with each other and control vital processes. Bioelectrical phenomena in the body. Bioelectrical phenomena are ubiquitous in the human body. Every cell possesses an electrical charge, which arises from the distribution of ions on both sides of the cell membrane. This charge generates a membrane potential, which is crucial for cell function. The membrane potential is maintained by the movement of ions such as sodium, Na, potassium, K, chloride, Cl, and calcium, Ca raised to the power of 2, which are transported through special channels in the cell membrane. Bioelectrical phenomena are essential not only for cell function but also for communication between cells. Electrical signal transmission plays a particularly crucial role in the nervous system. Nerve cells, or neurons, communicate via electrical impulses called action potentials. These are generated by the rapid exchange of ions across the cell membrane and propagate along the nerve fibers. This allows information to be transmitted over long distances in the body, for example, from the sensory organs to the brain or from the brain to the muscles. But bioelectrical signals aren't only important in the nervous system. Electrical impulses are also essential for regulating vital functions in other tissues, such as the heart, muscles, and even the digestive system. The heart generates its own electrical impulses that control the heart rhythm, while muscle cells use electrical signals to contract. Cell communication through electrical signals. Cells in the body communicate not only through chemical signals such as hormones and neurotransmitters, but also through bioelectrical signals. These signals are crucial for coordinating cellular activity and maintaining homeostasis, the balance of physiological processes. Junctions play an important role in cell communication. These special connections enable the direct exchange of ions and small molecules between neighboring cells. Through gap junctions, electrical signals can be transmitted quickly from cell to cell, enabling the synchronization of cell groups. A well-known example of this is the cardiac muscle cell, where electrical signal transmission is responsible for the rhythmic contraction of the heart. Another bioelectrical phenomenon of interest to bioresonance is the fact that cells are capable of responding to external electromagnetic fields. Research has shown that certain electromagnetic frequencies can influence cell activity by altering the ion concentration within the cell or affecting the function of the cell membrane. This could explain how bioresonance therapy works by using specific frequencies to correct disrupted cell communication and restore the cell's natural bioelectrical activity. Significance for bioresonance. Bioresonance therapy is based on the assumption that illnesses or dysfunctions in the body are caused by disrupted bioelectrical processes. The application of specific electromagnetic oscillations is intended to correct these disturbances and restore natural cell communication. The body is viewed as a network of cells connected by bioelectrical and electromagnetic signals. By measuring and modulating these signals, bioresonance devices attempt to restore balance in the body and promote healing. Research and application. The study of bioelectrical phenomena is a growing field of interest not only for bioresonance therapy but also for other medical applications. Conventional medicine is already developing therapies that use electrical stimulation for healing, such as transcranial magnetic stimulation, TMS, or pacemaker technology. Although scientific research on bioresonance is limited, studies on cell communication and bioelectrical phenomena indicate that there may be plausible mechanisms that explain how electromagnetic fields affect the body. These findings could contribute to greater acceptance and a deeper understanding of bioresonance therapy in the future. Principle of resonance and vibrations. The principle of resonance and vibration is at the heart of bioresonance therapy and many other frequency therapy methods. Resonance is a physical phenomenon that occurs when a system reacts to an external vibration or frequency that corresponds to its natural frequency. This principle can be applied to various fields, from music to physics and even medicine, especially in bioresonance. Resonance, a fundamental physical phenomenon. Resonance occurs when an object or system vibrates because it is exposed to a frequency that matches its natural frequency. In physics, this means that energy is efficiently exchanged between two systems when they vibrate at the same frequency. A classic example of resonance is a tuning fork. When struck, it generates a vibration at a specific frequency. If a second tuning fork nearby has the same frequency, the vibration of the first tuning fork will also cause it to vibrate, even though it hasn't been directly touched. This phenomenon is called resonance and plays a crucial role in bioresonance therapy. Resonance in the human body. Bioresonance is based on the assumption that the human body is a network of cells and organs that vibrate at specific frequencies. These frequencies represent the body's healthy state. However, when disturbances occur, whether due to illness, stress, or environmental influences, these vibrations can become unbalanced. The goal of bioresonance is to identify and correct these disturbed vibrations by introducing frequencies into the body that correspond to its natural resonance. These introduced frequencies are intended to stimulate the body's self-healing powers by restoring resonance and harmonizing the balance of vibrations within the body. For example, it is believed that every cell and organ in the body has a specific healthy frequency. When a cell or organ's function is disrupted by external influences, such as toxins or emotional stress, this frequency changes. Bioresonance therapy aims to identify these disrupted frequencies and correct them with the correct resonant frequency. Vibrations and their role in bioresonance. Vibrations are not limited to the human ear, but exist in all areas of life. Every form of energy, be it light, sound, or electromagnetic waves, propagates in the form of vibrations. The human body also generates various types of vibrations, which arise from biochemical processes, the heartbeat, breathing, and the activity of brain cells. In bioresonance therapy, the body is viewed as a complex system that continuously generates vibrations. Disturbances in these vibrations can lead to health problems. Bioresonance therapy uses special devices to measure these vibrations and, if necessary, modulate them to restore balance in the body. Application of the resonance principle in bioresonance therapy. During a bioresonance session, the patient is connected to a bioresonance device via electrodes. This device records the body's natural vibrations and analyzes them to determine if certain frequencies are disturbed. Based on this analysis, the device can send targeted vibrations back to the body with the goal of restoring resonance and promoting energetic balance. This principle of resonance can be applied to various health conditions, from allergies to chronic pain to emotional distress. By harnessing the right vibrations, the body is said to be stimulated to regulate and heal itself. Differences between bioresonance and other forms of therapy. Bioresonance therapy is a unique form of treatment that differs from other therapies in several aspects. Its distinctive feature lies primarily in the way it uses electromagnetic vibrations to diagnose and treat the body. The following section highlights the key differences between bioresonance and other common therapies such as conventional medicine, homeopathy, acupuncture, and magnetic field therapy. 1. Bioresonance versus conventional medicine. The biggest difference between bioresonance and conventional medicine lies in the fundamental approach to diagnosis and treatment. While conventional medicine is primarily based on biochemical processes and treats physical symptoms, bioresonance focuses on the body's energetic level and attempts to harmonize it. Diagnosis. In conventional medicine, diseases are often diagnosed through imaging techniques such as X-rays, MRI, or ultrasound, as well as laboratories tests involving blood, urine, and tissue samples. Bioresonance, on the other hand, uses electromagnetic vibrations to detect energetic imbalances in the body. Diagnosis is often made without invasive tests, but rather by measuring bioelectrical signals via electrodes placed on the body. Treatment. Conventional medicine typically uses medication, surgery, or physical therapy. Bioresonance, on the other hand, attempts to influence the body's own vibrational field through targeted frequencies. Instead of directly addressing symptoms, bioresonance aims to restore the body's energetic balance and stimulate the body's self-healing powers. Scientific recognition. Conventional medicine is supported by evidence-based research and enjoys broad scientific recognition. Bioresonance, on the other hand, is often viewed by conventional medicine as insufficiently scientifically proven, as there are only a few clinical studies demonstrating its effectiveness according to the criteria of evidence-based medicine. 2. Bioresonance versus homeopathy. Although bioresonance and homeopathy are both alternative medicines and aim to activate the body's self-healing powers, there are significant differences in their methods. Basic principle. Homeopathy is based on the principle of like cures like and uses highly diluted substances to stimulate the body's own healing processes. Bioresonance, on the other hand, works with electromagnetic vibrations to release energetic blockages and restore balance to the body. Application. In homeopathy, the patient is given a personalized remedy based on their specific symptoms. Bioresonance, on the other hand, does not require the ingestion of any substances. Instead, the patient is connected to a device that analyzes and modifies their body's own vibrations. Philosophy. Homeopathy follows a strictly energetic approach, in which even the physical molecules of the medicine are often present in such low concentrations that they are undetectable. Bioresonance, on the other hand, is based on the idea that measurable electromagnetic frequencies can influence the body's vibrational pattern. 3. Bioresonance versus acupuncture. Acupuncture, one of the oldest forms of therapy in the world, and bioresonance share certain similarities, particularly with regard to the energetic concept of the body. Both methods view the body as a network of energy flows, but their treatment approaches differ significantly. Energy flow. In acupuncture, treatment is based on the concept of meridians, through which the life energy key flows. By placing needles at specific points along these meridians, the energy flow is regulated and blockages are released. In bioresonance, the body's energy flow is influenced by electromagnetic vibrations, but needles are not used. Instead, electrodes are used to measure and adjust the body's frequencies. Treatment approach. Acupuncture is a manual therapy in which the positioning of the needles plays a central role. Bioresonance, on the other hand, works with technological devices that transmit and receive electromagnetic frequencies, while acupuncture focuses on working directly with the body. Bioresonance is more concerned with modulated feedback between the body and the device. Scientific recognition. Acupuncture has gained increasing recognition in Western medicine in recent decades, particularly for the treatment of pain and nausea. Bioresonance, on the other hand, is even less recognized, although it has reportedly achieved similar success in practice. 4. Bioresonance versus magnetic field therapy. Magnetic field therapy and bioresonance therapy are somewhat similar in that both work with electromagnetic fields, but there are important differences in their approaches and applications. Technology. Magnetic therapy uses static or pulsating magnetic fields to stimulate the body. These fields are intended to improve circulation, reduce inflammation, and promote healing. Bioresonance, on the other hand, uses specific frequencies tuned to the patient's individual vibrational patterns. These frequencies are intended to correct disturbed resonance fields in the body. Treatment goal. While magnetic field therapy is often used to treat pain, wound healing, and bone fractures, bioresonance therapy is used for a broader range of conditions, including allergies, chronic illnesses, and psychosomatic disorders. Bioresonance focuses more on harmonizing the body's entire energetic field, whereas magnetic field therapy often targets specific areas. How bioresonance works. How bioresonance affects the body. Bioresonance therapy is based on the idea that the human body is a network of electromagnetic vibrations. Every cell, organ, and substance in the body is said to possess a specific frequency that reflects the state of health or illness. When these frequencies become unbalanced, illnesses and discomfort can occur. Bioresonance therapy aims to correct this energetic imbalance to return the body to a healthy state. But how exactly does bioresonance affect the body? recording and analyzing vibrations. The first step in bioresonance therapy is measuring the body's own electromagnetic vibrations. For this, the patient is connected to a special bioresonance device via electrodes. These electrodes can be placed at various points on the body, depending on the areas to be examined or treated. The device measures the electromagnetic frequencies emitted by the body. These vibrations contain information about the energetic state of the cells and organs. The bioresonance device then analyzes these vibrations to determine if there are any frequencies that indicate an imbalance or disorder. In bioresonance theory, illnesses and dysfunctions are interpreted as disturbed vibrations or disharmonious frequencies in the body. The goal of therapy is to identify and harmonize these disharmonious frequencies. Correction by modulated oscillations. Once the bioresonance device has identified the disturbed frequencies, the actual treatment begins. The device sends specially modified electromagnetic vibrations back into the body. These vibrations are intended to balance the disturbed frequencies and return the body to its natural, healthy vibrational state. The effect of bioresonance can be explained by the principle of resonance. When a system, in this case, the body or an organ encounters an external frequency that corresponds to its natural frequency, it begins to resonate. This phenomenon is used to harmonize the body's own vibrations and restore energetic balance. It is believed that the disturbed vibrations can be inverted, so that the body perceives them as healing. Treatment on an energetic level. A key aspect of bioresonance therapy is that it works on the energetic level of the body rather than directly intervening on the physical level. This distinguishes it from conventional medical approaches, which often use medications to influence biochemical processes or perform surgical interventions to correct physical problems. Bioresonance, on the other hand, views the body as a complex energetic system regulated by vibrations. The approach of bioresonance is to release the energetic blockages in the body that are considered the cause of illness. By harmonizing the vibrations, the body is enabled to regulate and heal itself. This occurs without the use of medication or invasive techniques, making bioresonance a gentle and non-invasive method. Areas of application. Bioresonance is used in practice for a wide range of complaints and illnesses. These include acute and chronic pain, allergies, digestive disorders, skin problems, sleep disorders, and psychosomatic illnesses. Bioresonance is particularly well known for its success in treating allergies. It is believed that by identifying and correcting the specific frequencies triggered by allergens, the body's allergic reaction can be reduced or even eliminated. Another area of application is detoxification of the body. Many therapists use bioresonance to support the body in eliminating harmful substances and toxins. These substances are believed to disrupt the body's natural vibrations and lead to health problems. Bioresonance is intended to neutralize these harmful frequencies and stimulate the body's detoxification processes. Conclusion. Bioresonance therapy affects the body by measuring, analyzing, and correcting its electromagnetic vibrations. By restoring energetic balance, the body is supposedly enabled to regulate and heal itself. Although the exact mechanism of action of bioresonance is scientifically controversial, many patients and therapists report positive results, particularly for chronic complaints and allergies. Bioresonance offers a non-invasive alternative to conventional medicine and focuses on the energetic harmonization of the body. Activate self-healing powers. A central goal of bioresonance therapy is to activate the body's self-healing powers. Alternative medicine assumes that the body has a sophisticated system of self-regulation and self-healing that can be disrupted by internal and external influences. Bioresonance aims to reactivate these natural healing processes by bringing the body into energetic balance. The concept of self-healing powers. Self-healing refers to the body's ability to regenerate and repair itself. This concept is not new. It is a fundamental principle in many traditional healing methods and is also recognized in modern medicine. The body has numerous mechanisms to ward off disease, heal injuries, and maintain normal health. Examples of self-healing powers include the immune response to infections, the repair of tissue after injury, or the regulation of metabolic processes to maintain homeostasis. These powers often work unconsciously and without our intervention as long as the body is in a healthy state. Bioresonance therapy assumes that these self-healing powers can be blocked or weakened when the body's energy is out of balance. Disharmonious frequencies caused by stress, environmental toxins, poor nutrition, or other factors can impair the body's ability to heal itself. Bioresonance therapy attempts to eliminate these energetic disturbances so that the body can once again activate its natural self-healing processes. Strengthening self-healing through bioresonance. Bioresonance therapy strengthens the body's self-healing powers by harmonizing the disturbed vibrations in the body. It follows the idea that every cell and organ in the body has its own healthy vibration, which can be disrupted by internal and external influences. By restoring these vibrations to balance using the bioresonance device, the body can reactivate its natural healing mechanisms. One example of this is the treatment of chronic pain. Conventional medicine often uses painkillers to relieve symptoms, but this doesn't address the root cause of the pain. Bioresonance, on the other hand, attempts to correct the underlying energetic imbalances that may be responsible for the pain. By restoring energetic balance, the body can mobilize its own repair mechanisms to reduce or even eliminate the pain. Another example is the treatment of allergies. Allergies occur when the immune system overreacts to harmless substances. Bioresonance therapy aims to harmonize the frequencies that are disrupted by contact with allergens. This is intended to relieve the immune system and restore natural immune regulation, so that the body reacts less strongly to the allergens. Prevention by activating the body's self-healing powers. Another important aspect of bioresonance is its preventative effect. By strengthening the body's self-healing powers, the therapy can not only treat existing illnesses but also help prevent the development of new ones. Through regular use of bioresonance, energetic imbalances can be detected and corrected early, before they manifest in the form of physical symptoms. This preventative application of bioresonance is often used for people who suffer from chronic stress or who regularly come into contact with environmental toxins. In such cases, bioresonance can help support the body's natural detoxification processes and strengthen the immune system, making the body better able to defend itself against pathogens and harmful influences. Areas of application and limitations of bioresonance. Bioresonance therapy is used in alternative medicine for a wide variety of ailments and health problems. Its non-invasive nature and focus on harmonizing the body's energetic fields make it an attractive option for patients seeking gentle healing methods. Despite its widespread use and positive feedback from users, there are also clear limitations. recognized by both proponents and critics. This section explains the main applications of bioresonance, as well as its potential limitations and restrictions. Areas of application of bioresonance. Bioresonance therapy is used to treat a variety of illnesses and conditions, primarily in naturopathy and complementary medicine. The most common areas of application include 1. Allergies and intolerances. One of the best-known applications of bioresonance therapy is the treatment of allergies and intolerances. In allergies, the immune system reacts hypersensitively to certain substances such as pollen, pet dander, food, or dust. Bioresonance attempts to identify the specific frequencies of allergens and harmonize the disturbed frequency patterns to normalize the immune system's response. Many patients report relief or even complete disappearance of their allergic symptoms after bioresonance treatment. 2. Chronic pain and inflammation. Another common area of application is the treatment of chronic pain and inflammatory diseases. Patients with back pain, migraines, arthritis, or rheumatic complaints often seek alternative therapies when conventional approaches fail to provide sufficient relief. Bioresonance aims to correct the underlying energetic imbalances that may be responsible for the chronic pain. By harmonizing the vibrations, the body's self-healing powers can be activated, which can lead to pain relief. 3. Skin diseases. Bioresonance therapy is also frequently used for skin problems such as atopic dermatitis, psoriasis, and acne. These skin conditions can be exacerbated by a compromised immune system or by stress and environmental factors. Bioresonance is said to help release the energetic blockages that impair skin health and promote skin regeneration. 4. Digestive problems and metabolic disorders. Digestive complaints such as irritable bowel syndrome, bloating, constipation, and food intolerances are also common indications for bioresonance therapy. By analyzing the frequencies associated with digestive function, energetic disturbances can be identified and treated. The goal is to normalize digestion and balance metabolism. 5. Stress and psychosomatic complaints. Bioresonance is also used to treat psychological and psychosomatic complaints such as stress, sleep disorders, anxiety, and exhaustion. These complaints are often considered to be the result of energetic blockages in the body. By restoring energetic balance, the nervous system is supposedly calmed and emotional stability is promoted. 6. Detoxification and prevention. Another important application is supporting detoxification and disease prevention. Bioresonance is said to help rid the body of environmental toxins, heavy metals, and other harmful substances by stimulating natural detoxification processes. Many therapists also use bioresonance preventively to keep the body in balance and strengthen the immune system before diseases develop. Limits of bioresonance. Despite its many potential applications, bioresonance therapy also has clear limitations, which are acknowledged by both critics and therapists. These limitations are often due to the lack of scientific recognition, the limited research available, and the specific mode of action of bioresonance. 1. Lack of scientific evidence. One of the biggest criticisms of bioresonance therapy is the lack of solid scientific evidence supporting its effectiveness. Although many patients report positive experiences, there are few well-designed clinical studies demonstrating the effectiveness of bioresonance. In the scientific community, The method is often viewed as pseudoscientific because its underlying concepts, such as the resonance frequencies of organs and cells, are not sufficiently supported by studies. 2. Limited applicability in severe diseases. Bioresonance therapy has its limitations, particularly in cases of serious and acute illnesses such as cancer, heart attacks, or serious infections. While it can provide relief from chronic complaints and functional disorders, it is not a substitute therapy for life-threatening illnesses. In such cases, bioresonance should be viewed more as a supportive measure that can be used in combination with conventional treatments. 3. Subjective success and placebo effect. Many of the successes patients experience with bioresonance could also be due to the placebo effect. Because bioresonance is often based on subjective sensations and individual vibration patterns, it is difficult to objectively measure its effectiveness. The positive effects could be partly due to patients' belief in the effectiveness of the therapy and thus experiencing an improvement in their condition. 4. Individualized treatment and lack of standardization. Bioresonance therapy is highly individualized and tailored to the specific energetic patterns of each patient. This means there are no standardized protocols that are the same for all patients. This can lead to differences in treatment quality and results, as therapy success depends heavily on the experience and expertise of the therapist. Conclusion. Bioresonance therapy offers a wide range of possible applications, particularly for chronic complaints, allergies, skin diseases, and psychosomatic disorders. It can be a gentle and non-invasive alternative or complement to conventional medicine. However, it also has clear limitations, particularly in the treatment of serious illnesses and in terms of scientific recognition. Patients should be aware of the limitations of bioresonance and ideally use it as part of a holistic treatment approach that also includes conventional medical methods. Application of bioresonance in practice. Preparation and conduct of a bioresonance session. Conducting a bioresonance session requires careful preparation and planning on the part of both the therapist and the patient. Although bioresonance is considered a gentle and non-invasive therapy, it is important that the treatment is individually tailored to the patient. This section describes the steps that are performed before and during a bioresonance session. Preparation of the patient. Patient preparation often begins with a detailed initial consultation. During this consultation, the therapist gathers all relevant information about the patient's medical history, current symptoms, lifestyle habits, emotional stress, and possible environmental influences that may contribute to their condition. This information is crucial for individually adapting bioresonance therapy and developing a personalized treatment plan. Before the actual session, the patient is often asked to follow some general guidelines to maximize the effectiveness of the therapy. These include, but are not limited to, avoid caffeinated drinks, nicotine and alcohol. These substances can affect the body's natural vibrations and distort the results. Adequate hydration. The patient should drink enough water before the session to keep the body well hydrated, as fluid improves the conductivity of the electromagnetic signals. State of relaxation. The patient should come to the session as relaxed as possible, since stress and tension can influence the body's own vibrations. Preparation of the therapist. Before the session, the therapist must also make some preparations. This includes calibrating the bioresonance device to ensure it can perform precise measurements and modulations of the vibrations. The therapist will also prepare the electrodes or sensors that will be used during the session to measure the body's own frequencies. Depending on the bioresonance device and application method, the therapist can adjust various settings to tailor the session to the patient's specific needs. There are a variety of programs and frequency patterns that can be used to diagnose and treat various conditions. Conduct of the meeting. Once the patient is prepared and comfortably seated or lying down, the actual bioresonance session begins. The therapist attaches electrodes or sensors to specific parts of the body, usually the hands, feet, or head. These electrodes are connected to the bioresonance device and record the body's electromagnetic vibrations. The first step in the session is usually measuring the body's own frequencies. The device analyzes the vibrations and looks for deviations or imbalances that could indicate health problems. This analysis is often performed in real time, and the therapist can use the collected data to draw conclusions about the patient's energetic state. Based on the analysis results, the device begins to send harmonic vibrations back into the body. These modified vibrations are intended to correct the disturbed frequencies and restore the body to a healthy energetic balance. The patient typically does not experience any unpleasant sensations during the session, as the electromagnetic vibrations are non-invasive and gentle. A typical bioresonance session lasts approximately 30 to 60 minutes, depending on the complexity of the patient's condition and the treatment plan. During the session, the patient can relax, as no active movement or intervention is required. After the meeting, after the session, the therapist often offers advice on how the patient can support the healing process. This may include recommending continued drinking plenty of water to promote detoxification and getting plenty of rest. Sometimes, additional sessions are recommended for sustained results, especially for chronic or long-standing conditions. The therapist may also encourage the patient to keep a diary of their symptoms to document changes and improvements. This can be helpful in adjusting the treatment plan. Importance of regularity. In many cases, bioresonance therapy requires multiple sessions to achieve long-term improvements. The therapist will regularly review the treatment progress and adjust the frequencies or vibration patterns to respond to changes in the patient's health. Patients who regularly undergo bioresonance therapy often report gradual but sustained improvements in their symptoms. Conclusion. The preparation and conduct of a bioresonance session are important components of the therapy, ensuring that the patient is in a relaxed and receptive state. The session itself is gentle and non-invasive, and the frequencies are individually tailored to the patient to restore energetic balance and activate the body's self-healing powers. Bioresonance typically requires multiple sessions to achieve lasting results and can be optimized through close collaboration between patient and therapist. Diagnostic options. Bioresonance not only offers therapeutic possibilities but also plays an important role in the diagnosis of health disorders. Bioresonance diagnostics are based on the measurement and analysis of the body's electromagnetic vibrations, which are intended to provide information about the energetic state of cells and organs. These diagnostic techniques are particularly common in naturopathy and complementary medicine. The most important diagnostic possibilities of bioresonance are described below. Measurement of the body's own vibrations. At the heart of bioresonance diagnostics is the measurement of the body's own vibrations. Every organ and every cell in the human body generates electromagnetic frequencies that are interpreted as an expression of their state of health. When the body is healthy, the cells vibrate in a harmonious frequency pattern. However, if there is a disturbance in the body, these vibrations can become unbalanced and shift into disharmonious frequencies. The bioresonance device is designed to record and analyze these vibrations. Electrodes or sensors attached to the patient's body measure the electromagnetic signals. The device compares the measured frequencies with known healthy frequency patterns. Deviations from these patterns can indicate disease or dysfunction. Analysis of frequency patterns. The analysis of frequency patterns is a central element of bioresonance diagnostics. By examining the measured frequencies, the therapist can draw conclusions about the patient's health status. For example, disturbed frequencies in certain areas of the body can indicate problems such as inflammation, allergies, or toxic exposure. The bioresonance device often shows the therapist graphically or numerically which areas of the body are affected by disharmonious vibrations. This information is used to specifically identify vibrations that require treatment. An experienced therapist can also use the frequency patterns to determine whether the cause of an illness might be toxic exposure, an energetic imbalance, or an allergic reaction. Testing of substances. Another important diagnostic option for bioresonance is substance testing. The bioresonance device can be used to test how the body reacts to certain substances. This is particularly useful in diagnosing allergies or food intolerances. For example, the therapist places samples of potential allergens, such as pollen, food, or chemicals, into the bioresonance device and measures how the patient's body reacts to the frequencies of these substances. Through this testing, the therapist can determine which substances cause a disharmonious resonance in the body and potentially trigger symptoms. This method is often used to identify individual intolerances or allergic reactions without the need for invasive testing. Stress and strain diagnostics. Bioresonance can also be used to diagnose stress and strain in the body. Stress, both physical and emotional, can disrupt the body's energetic balance and lead to a variety of health problems. By measuring the vibrations, the therapist can determine whether the body is under stress and which areas are particularly affected. This form of diagnosis can help identify the underlying causes of stress-related complaints such as sleep disturbances, exhaustion, or anxiety. By identifying the stress-related frequency disturbances, the therapist can implement targeted therapeutic measures to restore the body's balance. Case studies and experience reports. Bioresonance therapy has attracted numerous users over the past decades, and many patients report positive experiences with this alternative method. Case studies and testimonials provide insights into the practical application and potential results of bioresonance. Even though the method remains scientifically controversial, these real-life examples illustrate the diverse effects of the therapy and how it can be adapted to individual health challenges. Case Study 1. Treatment of allergies. A common application of bioresonance therapy is the treatment of allergies. A 35-year-old man had suffered from a severe pollen allergy since childhood, which worsened during the spring and summer months. Conventional antihistamines offered only limited relief, and he sought an alternative treatment method. After a thorough medical history, the therapist decided to use bioresonance to identify the pollen frequencies and harmonize the vibrations. The patient received several sessions during the allergy season. After just the third session, the patient noticed a significant improvement in his symptoms. His sneezing and watery eyes were significantly reduced, and he required less medication than in previous years. After further treatments, the patient reported that his symptoms were significantly less intense in the following years and that he felt better overall. Case Study 2. Chronic pain. A 50-year-old woman suffered from chronic back pain caused by degenerative changes in her spine. Despite physical therapy, pain medication, and alternative therapies, she struggled with severe pain every day and was limited in her ability to work. After a bioresonance diagnosis, the therapist identified several energetic blockages in the back and digestive tract that may have been related to the pain. Over a period of 2 months, the patient received weekly bioresonance sessions. The frequencies were tuned to the pain areas and the digestive system. After the first few sessions, the patient experienced slight relief. With each subsequent session, the pain improved, and the patient was able to return to normal work after about 6 weeks. Her pain was not completely gone, but she reported a significant improvement in her quality of life and a noticeable reduction in pain medication. Patient testimonials. Many patients report similar positive effects of bioresonance therapy for various conditions. A mother with a 6-year-old child who suffered from recurring respiratory infections and allergic reactions describes how bioresonance therapy helped strengthen her child's immune system and reduce susceptibility to infections. After a series of treatments, the child experienced fewer absences from illness and showed improved response to allergens. Another report comes from a 40-year-old man who suffered from constant fatigue and sleep disturbances. After a comprehensive bioresonance diagnosis, the therapist determined that the patient was energetically burned out, likely due to long-term stress and overwork. After several sessions, the patient reported a significant improvement in his sleep quality and an increase in energy and vitality in his daily life. Limitations of case studies and experience reports. While case studies and testimonials provide valuable insight into the potential successes of bioresonance therapy, they are also subjective and often based on personal experience. It is important to note that the effectiveness of bioresonance can vary from individual to individual, and not all patients experience the same positive results. Nevertheless, these reports illustrate the range of possible applications and the potential benefits for patients seeking alternative treatment methods. Conclusion. Case studies and testimonials demonstrate that bioresonance therapy can, in many cases, have a positive effect on various health conditions. Although results vary from individual to individual, many patients report relief from their symptoms and an improvement in their quality of life. These examples illustrate the potential effectiveness of bioresonance and make it an interesting alternative or complement to conventional medicine, especially for chronic and difficult to treat conditions. The therapeutic process. The therapeutic process of a bioresonance treatment follows a clearly structured procedure tailored to the individual patient's health. From the initial consultation through diagnosis to the actual treatment, each step is carefully planned and tailored to the patient's specific needs. The following section describes the process of a typical bioresonance therapy and explains how the treatment is carried out. Initial consultation and medical history. The first step in the therapeutic process is a detailed medical history and consultation. The therapist gathers information about the patient's medical history, current symptoms, lifestyle habits, and possible stress factors. This medical history is crucial for gaining an overview of the patient's health and tailoring the therapy to the individual. An experienced bioresonance therapist will also ask specific questions about allergies, intolerances, emotional stress, and environmental exposure. The medical history serves as the basis for subsequent diagnostics and the development of a treatment plan. Bioresonance diagnosis. After the medical history, the actual bioresonance diagnosis takes place. The patient is connected to electrodes or sensors that measure their body's electromagnetic vibrations. The bioresonance device analyzes these vibrations and identifies deviations or imbalances that could indicate health problems. The diagnosis typically takes between 30 and 60 minutes. During this time, the therapist receives detailed information about the patient's energetic state. This can provide clues to the cause of the symptoms and help the therapist adjust the treatment plan accordingly. Creation of a treatment plan. Based on the results of the diagnosis, the therapist creates an individualized treatment plan. This plan takes into account the patient's specific energetic imbalances and determines which frequencies should be used to harmonize the body. The treatment plan typically includes several sessions. As bioresonance therapy often has a cumulative effect, the therapist will determine the number and frequency of sessions depending on the severity of the symptoms and the patient's response to therapy. Conducting bioresonance sessions. The actual bioresonance session is a central part of the therapeutic process. The patient is positioned comfortably, either sitting or lying down, and electrodes are placed on the appropriate body parts. The bioresonance device analyzes the body's own vibrations again and sends modified frequencies back into the body to harmonize any energetic imbalances. A typical session lasts approximately 30 to 60 minutes. During this time, the patient can relax, as the treatment is non-invasive and requires no active intervention. The therapist monitors the process and adjusts the device settings as needed to achieve optimal results. Follow-up and debriefing. After each session, a brief debriefing session is held, during which the therapist reviews progress and asks the patient about their feelings. Any changes or improvements in symptoms are recorded to assess the effectiveness of the therapy. Depending on the progress of the treatment, the therapist will adjust the treatment plan. If necessary, additional measures may be recommended, such as dietary changes, stress management strategies, or the use of nutritional supplements to support the healing process. Continuous adjustment of the therapy plan. During the course of bioresonance therapy, it is important to regularly review the treatment plan and adjust it as needed. The body can respond differently to treatment, so flexibility is crucial to optimize the healing process. The therapist will closely monitor the patient's progress and adjust the frequencies and vibrations accordingly. In cases of chronic illnesses or long-standing complaints, long-term care and regular monitoring are necessary to ensure the success of the therapy. This may mean that the patient receives regular sessions over several months to gradually restore the body's balance. Completion of therapy and follow-up care. Once the patient experiences significant improvement or complete healing of their symptoms, therapy can be concluded. The therapist will conduct a final diagnosis during the final session to ensure that energetic balance has been restored. In some cases, follow-up care is recommended, with the patient returning at longer intervals to monitor and prevent further symptoms. Integration of bioresonance into everyday life. Bioresonance therapy can be used not only in clinical treatments but also integrated into everyday life as part of a holistic approach to promote health and well-being. Patients who benefit from bioresonance often find ways to incorporate the therapy into their daily routines to achieve long-term improvements and maintain their body's energetic balance. Regular prevention meetings. One way to integrate bioresonance into daily life is to use regular sessions to prevent health problems. Many therapists recommend continuing regular bioresonance sessions after an intensive treatment phase that alleviates specific complaints to maintain energetic balance. This could be done once a month or every few months, depending on the patient's individual condition and health goals. These preventative sessions help identify and correct energetic imbalances early, before they develop into serious health problems. This allows patients to integrate bioresonance into their lifestyle as a kind of energetic checkup. Support through healthy lifestyle habits. To maximize the positive effects of bioresonance therapy, it is important to combine it with healthy lifestyle habits. This includes a balanced, nutrient-rich diet, adequate exercise, and stress management. A healthy lifestyle supports the body in maintaining energetic balance and utilizing the self-healing powers stimulated by bioresonance. Many therapists offer their patients post-treatment advice on how to adjust their lifestyle to optimize results. These include nutrition, eating fresh, unprocessed foods and avoiding sugar. Preservatives and unhealthy fats can help keep the body energetically balanced. Hydration. Adequate hydration is crucial to supporting the flow of energy in the body. Water is an excellent conductor of bioenergetic vibrations. Exercise. Regular physical activity supports blood circulation and energy circulation in the body, which can enhance the effects of bioresonance. Stress management and mindfulness. Another important factor for integrating bioresonance into everyday life is stress management. Stress is one of the biggest factors that can disrupt the body's energetic balance. Techniques such as meditation, breathing exercises, yoga, or mindfulness practice can help reduce stress levels and calm the body naturally. By incorporating stress management techniques into their daily routine, patients can support the effects of bioresonance therapy and achieve lasting improvements in their overall well-being. The combination of bioresonance and stress management strategies promotes regeneration and energetic balance. Use of home devices. Some patients choose to invest in bioresonance home devices to continue therapy independently in their daily lives. These devices are specifically designed for use outside of the office and can be used for regular treatment of minor complaints or for preventative purposes. However, before using a home device, it is advisable for a patient to receive comprehensive training from an experienced therapist. The therapist can help select the appropriate frequencies and programs and ensure the device is used effectively and safely. Support through regular communication with the therapist. Ongoing communication with the bioresonance therapist is another important aspect of integration into daily life. Regular check-ins and discussions allow the therapist to monitor the patient's progress and adjust the therapy plan as needed. This collaboration promotes continuous improvement and supports the patient in achieving their long-term health goals. Conclusion. Integrating bioresonance into everyday life can sustainably support therapy success and enhance overall well-being. Regular sessions, combined with healthy lifestyle habits, stress management, and, if necessary, the use of home devices, help maintain the body's energetic balance. Through close collaboration with an experienced therapist, patients can optimally integrate bioresonance into their daily lives and benefit from its positive effects. Use for various complaints, for example allergies, pain, etc. Bioresonance therapy has established itself as a versatile method in alternative medicine and is used to treat a wide range of ailments. Because it targets the body's energetic balance, it is used for a variety of chronic and acute health problems. The most common areas of application for bioresonance are described in detail below. Allergies and intolerances. One of the most well-known and frequently treated conditions with bioresonance is allergies and intolerances. Allergies occur when the immune system becomes oversensitive to normally harmless substances such as pollen, pet dander, dust, or certain foods. Bioresonance therapy aims to correct the energetic imbalance in the body caused by the reaction to these allergens. In practice, bioresonance therapy is often used to detect and harmonize the vibrations of allergenic substances. This can lead to a less intense reaction to allergens and alleviate allergic symptoms. Many patients report experiencing a significant improvement in their symptoms after a few bioresonance sessions. Chronic pain. Chronic pain is another common application for bioresonance. Patients with conditions such as arthritis, fibromyalgia, back pain, or migraines often seek alternative therapies when conventional treatments are insufficient. Bioresonance therapy attempts to correct the underlying energetic disturbances that may be responsible for the pain. By applying specific frequencies to affected areas of the body, bioresonance can help reduce pain perception and support the healing process. Some patients report a significant reduction in their pain and improved quality of life after several sessions. Skin problems. Bioresonance is also successfully used to treat skin problems such as eczema, psoriasis, acne, and atopic dermatitis. Skin problems can be caused by a variety of factors, including stress, allergies, or metabolic disorders. Bioresonance therapy aims to correct these underlying energetic imbalances and support the body in regenerating the skin from within. Especially with chronic skin conditions, patients report a gradual improvement in their skin's appearance after several sessions. The treatment can reduce inflammation and promote overall skin well-being. Digestive problems. Digestive problems such as irritable bowel syndrome, bloating, constipation, and food intolerances are also among the conditions for which bioresonance therapy is often used. These conditions can be caused by an imbalance in the digestive system, which bioresonance aims to correct. By harmonizing the frequencies associated with digestive function, bioresonance can help regulate the digestive process and alleviate symptoms. Patients report better digestion, less discomfort, and overall improved intestinal health after treatment. Stress-related complaints and psychosomatic disorders. Bioresonance is also frequently used for stress-related complaints and psychosomatic disorders. Stress and emotional strain can disrupt the body's energetic balance and lead to physical symptoms such as insomnia, headaches, exhaustion, or anxiety. Bioresonance therapy can help resolve these energetic disturbances and restore the body to a healthy balance. Many patients report a noticeable improvement in their emotional and physical well-being, better sleep quality, and a reduction in stress symptoms. Heavy metal pollution and detoxification. Another application of bioresonance is to support the detoxification of heavy metals and other toxic substances. Exposure to environmental toxins can significantly disrupt the body's energetic system and lead to a variety of health problems. Bioresonance therapy attempts to neutralize toxic vibrations and support the body in detoxification. The application of specific frequencies is intended to stimulate the body's natural elimination processes, allowing heavy metals and other harmful substances to be broken down and eliminated more efficiently. This form of detoxification can be particularly beneficial for people suffering from chronic fatigue syndromes, recurring infections, or general exhaustion caused by toxic exposure. Many patients report increased energy levels and improved well-being after bioresonance therapy, as the body is once again able to effectively detoxify and regenerate. Especially after intensive treatment, it is often recommended to continue maintaining a healthy lifestyle to support long-term detoxification. Support of the immune system. A strengthened immune system is crucial for fighting off disease and maintaining good health. Bioresonance can help regulate the immune system by correcting energetic imbalances that could weaken it. This therapy can be used especially for patients with chronic infections or a susceptibility to colds and flu. In practice, bioresonance is often used to strengthen the immune system in people recovering from serious illnesses or whose immune systems have been weakened by stress and environmental influences. After treatment, many patients report improved resistance to infections and a generally improved sense of vitality. Limits of bioresonance in serious illnesses. Although bioresonance can be effective for many conditions, it also has clear limitations, particularly in serious and acute illnesses such as cancer, heart attacks, or serious infections. While bioresonance therapy can be used as a supportive measure in such cases, it should not be considered the primary treatment method. In these situations, conventional medical treatment is essential, and bioresonance can act as a complementary therapy by strengthening the immune system and supporting the healing process. Combination with other forms of therapy. Bioresonance therapy can be easily combined with other alternative and conventional therapies. Many therapists integrate it into a holistic treatment concept that also includes, for example, acupuncture, homeopathy, herbal medicine, or physiotherapy. This multidisciplinary approach can enhance the effects of bioresonance and lead to better overall results, especially for chronic diseases, which often require treatment on multiple levels. Bioresonance can be used as one of many supportive measures. Patients often report that the combination of different therapeutic approaches has brought them more comprehensive relief and improved their overall health. Bioresonance devices and their handling. Introduction to bioresonance device types. Bioresonance therapy is based on the measurement and modulation of the body's electromagnetic vibrations, and the devices used for this purpose have undergone continuous development over the past decades. Today, there are various types of bioresonance devices used in practice depending on their application and mode of operation. Choosing the right device depends on the patient's needs, the nature of the complaint, and the therapist's specific preferences. The most common types of bioresonance devices and their key features are presented below. 1. Mora devices. The Mora devices are the original bioresonance devices and date back to their inventors, Dr. Franz Morel and Erich Rasch. The name Mora is derived from the initials of their last names. These devices are considered the basis of modern bioresonance technology and work with the body's own vibrations, which are measured, inverted, and then fed back into the body. Mora devices are widely used for both the diagnosis and treatment of various health conditions. Mora devices are capable of measuring different frequency spectra, from low to medium to high frequencies. They enable a detailed analysis of the body's own vibrations and precise adjustment of the returned frequencies to promote the healing process. 2. Bicam devices. Bicam devices are among the best known and most widely used bioresonance devices worldwide. They are frequently used to treat allergies, chronic pain, and psychosomatic complaints. Bicam devices also work with the patient's own body vibrations, but can also record and modify external frequency patterns. This enables a broader range of applications, including the treatment of toxic loads and energetic disturbances caused by environmental influences. A major advantage of Bicam devices is their ability to tailor treatment to the individual patient. They offer a variety of programs aimed at different health problems and are suitable for both acute and chronic conditions. 3. Vega-test devices. Vega-test devices are based on the electroacupuncture concept developed by Dr. Reinhold Voll, Ev. These devices measure electrical skin resistance at specific acupuncture points and compare it with standard values. This allows them to detect energetic disturbances in the body that could indicate health problems. Vega-test devices are often used to diagnose and treat allergies, intolerances, and chronic conditions. The focus of these devices is more on diagnosis than therapy, although some Vega-test devices also offer therapeutic functions. They are particularly popular in naturopathy and complementary medicine and are often used in combination with other methods such as homeopathy and acupuncture. 4. Multi-resonance devices. Multi-resonance devices are a further development of classic bioresonance technology and offer a combination of different frequency ranges and therapy systems. They allow the use of multiple frequencies simultaneously and affect different levels of the body. These devices are particularly popular with therapists who prefer a holistic approach and want to combine different treatment methods. Multi-resonance devices are capable of influencing the patient's physical, emotional, and energetic levels. They offer a wide range of applications and are often used for complex health conditions involving multiple factors. 5. Home devices for bioresonance. In recent years, home devices for bioresonance therapy have also become increasingly popular. These devices are specifically designed to allow patients to continue therapy independently at home. They are generally easier to use and offer pre-programmed frequency patterns for common complaints such as allergies, pain, and stress. Home devices are not as powerful as the professional devices found in a practice, but they still offer effective support for daily health care. Home devices are particularly suitable for patients who require regular bioresonance treatments but don't always have the opportunity to visit a practice. They allow for continuous therapy and can help support the healing process between sessions. How modern bioresonance devices work. Modern bioresonance devices are based on the idea that the human body emits electromagnetic vibrations that provide information about the body's state of health. These devices are designed to measure, analyze, and then modify these vibrations to restore the body's energetic balance. Modern bioresonance devices are technologically advanced and offer precise control over the frequencies that affect the body. The following explains how these devices work in detail. Recording the body's own vibrations. The first step in the functioning of a modern bioresonance device is the recording of the body's own electromagnetic vibrations. This is done using electrodes or sensors attached to the patient's hands, feet, or other parts of the body. These electrodes record the vibrations emitted by the body's cells, organs, and tissues. Each organ and cell has a specific frequency that is harmonious in a healthy state. However, pathological processes or energetic imbalances can lead to disharmonious frequencies, which the device measures. The measured vibrations are transmitted to the bioresonance device, which analyzes the data and compares it with a database of healthy frequency patterns. Deviations from these patterns indicate energetic disturbances in the body that can be treated. Analysis of frequency patterns. After the vibrations have been recorded, the device analyzes the body's frequency patterns. Modern bioresonance devices are capable of processing this data in real time, providing the therapist with a detailed overview of the patient's energetic states. The analysis reveals which areas of the body are affected by disharmonious vibrations and which specific frequencies can be used to harmonize them. This analysis is an important step in diagnosing health problems, as it indicates energetic imbalances that may be the cause of symptoms. The therapist can use the analyzed data to create an individualized treatment plan tailored to the patient's specific needs. Modulation and feedback of the harmonized vibrations. After the analysis, the actual therapy begins. Modern bioresonance devices are capable of modulating the measured disharmonious vibrations by inverting or amplifying them. These modified vibrations are then fed back into the patient's body to harmonize the energetic disturbances. The goal is to restore the body's natural vibration pattern and stimulate the healing process. The device modulates the vibrations based on previously measured frequency patterns. The harmonized vibrations sent back are intended to dissolve or neutralize the disturbed frequencies in the body, thus restoring energetic balance. This process can be repeated over several sessions to achieve a lasting improvement in health. Multi-resonance and frequency diversity. A special feature of modern bioresonance devices is their ability to work with multiple frequencies simultaneously. These multi-resonance devices are particularly effective because they cover different frequency bands and can thus affect different levels of the body simultaneously. These devices can work on the physical, emotional, and energetic levels, making them particularly versatile. The variety of frequencies that modern bioresonance devices can generate allows therapists to tailor treatment very precisely to the patient. Different frequencies can be used for different conditions. Low frequencies, for example, can contribute to calming and relaxation. Operation and maintenance of the devices. Proper operation and care of bioresonance devices are crucial to the effectiveness and longevity of this technology. The devices are precisely engineered to measure and modify electromagnetic vibrations. Therefore, it is important that therapists and users understand the basic operating principles and necessary maintenance steps to achieve the best possible results and extend the lifespan of the devices. Operating the devices. Using a bioresonance device begins with proper preparation. Before a session begins, the therapist should ensure the device is correctly calibrated and all connections have been properly made. The electrodes or sensors must be clean and in good condition to ensure accurate measurement of the vibrations. Here are the basic steps for operation. 1. Powering on and calibrating. The device should be powered on and calibrated according to the manufacturer's instructions. Some devices perform an automatic self-test upon startup to ensure they are functioning correctly. 2. Electrode placement. The patient is comfortably positioned, and the electrodes or sensors are applied to the designated areas, such as the hands, feet, or head. Placement depends on the type of treatment and the body areas to be analyzed. 3. Performing the measurement. The device records the body's own vibrations and displays the measured values to the therapist. Deviations from the normal frequency patterns are identified and used for further analysis. 4. Adjust therapy settings. Based on the analysis, the therapist selects the appropriate frequency patterns or programs to be used to harmonize the disturbed vibrations. Modern devices often have a variety of pre-programmed settings that can be adjusted to the patient's needs. 5. Frequency modulation. The device modulates the measured vibrations and sends the harmonized frequencies back into the patient's body to restore energetic balance. 6. Monitoring and adjustment. During the session, the therapist monitors the patient's responses and can adjust the settings if necessary to optimize the treatment. Care of the devices. Maintaining a bioresonance device is essential to ensure proper function and accurate measurements. Here are the key steps for maintenance. 1. Cleaning. After each session, the electrodes and sensors should be thoroughly cleaned to remove any contaminants and residues. Cleaning should be performed according to the manufacturer's instructions using appropriate disinfectants to avoid damage. 2. Calibration and maintenance. Bioresonance devices should be calibrated regularly to ensure accurate performance. Some devices require professional maintenance by the manufacturer or authorized technicians to ensure measurement accuracy. 3. Check cables and connections. All cables and connectors should be checked regularly for wear or damage. Defective cables can affect the quality of measurements and should be replaced if necessary. 4. Software updates. Modern bioresonance devices often have software that can be updated. It's important to perform regular updates to ensure the device is equipped with the latest technologies and features. 5. Storage. The device should be stored in a clean, dry place to avoid damage from moisture or dust. Extreme temperatures or direct sunlight may affect the electronics. Safety precautions. When using bioresonance devices, the manufacturer's safety guidelines should always be followed. It is important that the therapist informs patients about the non-invasive nature of the therapy, but also pays attention to possible intolerances or sensitivities. Some patients may be sensitive to electromagnetic fields, so it is important to monitor their reactions during therapy. Selecting the right device for different applications. Selecting the right bioresonance device is a crucial factor for the success of therapy, as each device offers different features and applications. Depending on the patient's needs and treatment goals, it may be beneficial to choose specific device types that are better suited to certain conditions. This section explains the key considerations and criteria for selecting the right bioresonance device for different applications. Consideration of the nature of the complaints. One of the most important factors when choosing a bioresonance device is the type of condition to be treated. Different devices offer different frequency programs and diagnostic tools optimized for specific conditions or health problems. Allergies and intolerances. Devices like the Bicam are particularly well suited for treating allergies. They offer specialized programs for analyzing and harmonizing allergic reactions and can use specific frequencies to regulate the immune system and relieve allergic symptoms. Chronic pain and inflammation. For patients suffering from chronic pain or inflammatory conditions, multi-resonance devices may be a good option. These devices offer a wide range of frequencies that act on different levels of the body, promoting pain relief and reducing inflammation. Skin problems and metabolic disorders. For skin problems such as atopic dermatitis or psoriasis, as well as metabolic disorders, a device with comprehensive analysis and modulation functions, such as the Mora system, can be beneficial. These devices enable a detailed diagnosis and targeted treatment of the energetic disturbances that affect the skin's condition. Scope and flexibility. Another important consideration when choosing the right bioresonance device is the device's range of applications and flexibility. Some devices are specialized for specific conditions, while others can cover a wide range of applications. Specialized devices. If the therapist specializes in certain conditions, such as allergies or chronic pain, it may be beneficial to choose a device specifically designed for those applications. Such devices often offer more specific programs and greater effectiveness in their respective areas. Versatile devices. For therapists who treat a wide range of conditions, multi-resonance devices or devices such as the Bicam are a good choice because they offer greater flexibility and have different programs for treating different health problems. Usability and training. The ease of use of a bioresonance device is also an important factor in the selection process. Some devices require extensive training to fully utilize their features, while others are more user-friendly and easier to operate. Especially for therapists new to bioresonance therapy or those who want to offer the device to patients for home use, it is crucial that the device is easy to understand and operate. Many manufacturers offer training and certifications to ensure therapists can utilize the device's full potential. It's advisable to inquire about training availability before purchasing a device. Budget and costs. Bioresonance devices vary greatly in price depending on their range of features, the brand, and the technologies offered. Therefore, the cost of the device should be considered, especially for practices just beginning to use bioresonance therapy. A basic model may be sufficient if your focus is on simple applications such as allergy treatments. However, if you plan to treat a wider variety of conditions, it might be worth investing in a more advanced device with more features. Conclusion. Choosing the right bioresonance device depends on several factors, including the type of condition being treated, the area of application, ease of use, and the available budget. Therapists should carefully consider which device best suits their needs and those of their patients. Choosing the right device is crucial to achieving the best possible results in bioresonance therapy. Tips for optimizing results. Bioresonance therapy can be very effective when properly implemented and supported. To achieve the best possible results, there are several approaches therapists and patients can use to maximize the effectiveness of sessions. This section presents some key tips for optimizing bioresonance therapy. 1. Individual adaptation of therapy. One of the greatest strengths of bioresonance is its flexibility. To achieve the best results, the therapy should be individually tailored to the patient and their specific complaints. This requires a careful analysis of energetic imbalances and the adaptation of the frequencies and programs used during the session. Taking a detailed medical history. A detailed medical history is key to understanding the underlying causes of symptoms. The therapist should take the time to gather all relevant information before therapy begins. Regular adjustment of the treatment plan. Since the body responds to the modulation of vibrations during bioresonance therapy, the treatment plan should be reviewed and adjusted regularly. The therapist can adjust the frequencies and programs depending on the patient's progress. 2. Combination with other forms of therapy. Combining bioresonance with other alternative and conventional treatment methods can significantly improve results. Bioresonance works best when it is part of a holistic approach that involves the entire body and mind. Dietary adjustments. A healthy diet can support the effects of bioresonance therapy by providing the body with the necessary nutrients for self-healing and energetic balance. Nutritional counseling can help reduce inflammatory foods and promote overall health. Stress management. Since stress is one of the biggest factors causing energetic imbalances, integrating stress management techniques such as yoga, meditation, or breathing exercises can enhance the effectiveness of bioresonance therapy. Complementation with homeopathy or acupuncture. Other complementary therapies such as homeopathy or acupuncture can work synergistically with bioresonance. These methods support the body's energetic balance and can enhance results. 3. Regularity of meetings. While a single bioresonance session can provide some relief from symptoms, the best results are often achieved through regular sessions. The body may require multiple sessions to fully release energetic blockages and restore balance. Maintain therapy cycles. Therapists should work with their patients to determine how often sessions should take place to achieve the best results. For chronic conditions, a regular therapy cycle may be necessary over several weeks or months. Long-term follow-up. Even after achieving the desired results, it is advisable to carry out occasional booster sessions to monitor and maintain the health status. 4. Hydration before and after sessions. Hydration plays an important role in bioresonance therapy, as water is an excellent conductor of electromagnetic vibrations. Patients should ensure they drink enough fluids before and after sessions to support the effects of the therapy. Before the session, patients should drink plenty of water before the session to ensure that the vibrations can be well transmitted through the body. After the session, after the treatment, it is important to continue drinking plenty of water to help the body detoxify and promote the healing processes stimulated by bioresonance. 5. Observation and documentation of changes. To evaluate the effectiveness of bioresonance therapy, it is helpful to observe and document the body's responses to the treatment. Patients should record their symptoms, changes, and progress after each session to provide the therapist with a basis for adjusting the therapy. Keep a symptom diary. A symptom diary can help track changes over time. Patients should note how they feel before and after sessions, whether their symptoms improve, and what changes they notice in their daily lives. Regular discussions with the therapist. This information can be evaluated during follow-up discussions with the therapist to further refine the therapy and ensure that it is achieving the desired effect. 6. Positive attitude and openness towards therapy. The placebo effect is well documented in medicine and can also play a role in bioresonance therapy. A positive attitude toward therapy can support healing by strengthening the patient's trust in the process and activating the body's own self-healing powers. Trust in the healing process. Patients who believe in the success of bioresonance therapy and are open to the idea that the body can be influenced by energetic methods often report better results. Open communication with the therapist. Honest and open communication between patient and therapist is crucial. Patients should clearly communicate their expectations, concerns, and experiences so the therapist can optimally adapt therapy. Bioresonance and conventional medicine. Integration of bioresonance into conventional medical treatments. Bioresonance therapy is a complementary medicine approach that aims to complement existing conventional medical treatments and promote holistic patient well-being. Integrating bioresonance into conventional medical care can be particularly beneficial for chronic illnesses, allergies, and psychosomatic complaints. The goal is not to replace conventional medicine, but rather to create a synergy between both approaches to improve treatment outcomes and provide more comprehensive patient care. Complementary use in chronic diseases. One major area where the integration of bioresonance into conventional medical treatment can be beneficial is the treatment of chronic diseases. Conventional medical approaches often focus on treating symptoms and using medications, whereas bioresonance can address the body's energetic imbalances that may have contributed to the disease. For example, patients suffering from chronic pain, digestive problems, or skin conditions may benefit from a combination of conventional medicine and bioenergetic approaches. While conventional medicine directly treats inflammation and symptoms, bioresonance could help restore energetic balance that has been disrupted by persistent stress, environmental toxins, or emotional distress. Support in regeneration and rehabilitation. Another area where bioresonance can be effectively integrated is supporting regeneration and rehabilitation after serious illnesses or surgical procedures. Patients recovering from surgeries, infections, or serious health crises can often benefit from additional therapy methods that strengthen the body's self-healing powers and promote regeneration. Bioresonance can play a supportive role here by energetically supporting the healing process and bringing the body into a state that complements conventional medical treatment. By improving cell communication and strengthening the immune system, bioresonance can accelerate the recovery process and help prevent complications. Use in preventive medicine. Preventive medicine aims to prevent diseases before they occur, and bioresonance therapy offers interesting possibilities here as well. Regular bioresonance sessions can detect and treat energetic imbalances early, even before they manifest as physical symptoms. Conventional medical examinations such as blood tests and imaging procedures can be supplemented with bioresonance to assess the patient's overall energetic picture and implement preventative measures. Combined therapeutic approaches. Many physicians and therapists working in complementary medicine incorporate bioresonance as part of a multimodal treatment plan. This can be the case, for example, in the treatment of allergies, where conventional medicine prescribes medications such as antihistamines, while bioresonance is used to harmonize energetic responses to allergens. Bioresonance can also play a complementary role in the treatment of psychosomatic disorders such as anxiety or insomnia by addressing energetic blockages in the body caused by stress or emotional distress. In combination with conventional medical approaches such as psychotherapy or medication, a holistic treatment can be achieved. Challenges of integration. Despite the potential benefits, there are also challenges to integrating bioresonance into conventional medical treatments. One of the main problems is the lack of scientific acceptance and the insufficient evidence base for bioresonance. Many conventional medical practitioners are skeptical of the method and consider it to be insufficiently scientifically sound. This can lead to reluctance to collaborate between conventional medical practitioners and therapists who use bioresonance. Another factor is the issue of billing and reimbursement. In many countries, bioresonance therapy is not covered by statutory health insurance, which can represent a financial burden for patients. This can limit the willingness to pursue complementary therapies, even though they could offer benefits when combined with conventional medicine. Opportunities and challenges of complementary therapy. The combination of conventional medicine and complementary therapeutic approaches such as bioresonance therapy offers many opportunities, but also presents some challenges. While more and more patients are seeking holistic treatment approaches that address both physical and energetic aspects, the integration of such methods must be carefully considered to ensure both efficacy and safety. Opportunities of complementary therapy. Complementary therapy offers numerous opportunities to complement conventional medicine and provide patients with more comprehensive care, especially for chronic diseases, which are often influenced by multiple factors. Complementary approaches can help improve patients' quality of life and support the healing process. 1. Holistic treatment approach. One of the greatest opportunities of complementary therapy is the ability to approach the patient holistically. While conventional medicine typically focuses on treating symptoms and combating disease, complementary medicine aims to restore the energetic balance of the entire body. This makes it possible to not only treat physical symptoms but also release emotional and energetic blockages that may be contributing to the disease. 2. Individualized treatment. Complementary therapies such as bioresonance offer a high degree of individualization, as they can be tailored to the specific energetic patterns of each patient. This contrasts with standardized conventional medical treatment protocols, which often only address a patient's individual needs to a limited extent. Personalized adaptation of therapy can achieve better results and minimize side effects. 3. Strengthening the body's self-healing powers. Many complementary therapy approaches focus on activating and supporting the body's natural self-healing powers. Bioresonance therapy, for example, aims to restore energetic balance so that the body is able to regulate and heal itself. This can play a particularly important role in chronic diseases, where conventional medicine often only treats symptoms. Challenges of complementary therapy. Despite the many opportunities, there are also challenges associated with the use of complementary therapies such as bioresonance. These primarily concern scientific acceptance, costs, and communication between different therapists. 1. Lack of scientific evidence. One of the biggest criticisms of complementary therapy approaches is the lack of scientific evidence supporting their effectiveness. Many complementary methods, including bioresonance, are based on concepts that are not fully accepted in conventional medicine. This often leads to skepticism toward these approaches and complicates their integration into conventional medical practice. The challenge is to advance research in this area to better understand the mechanisms behind these methods and scientifically substantiate their effectiveness. Studies with high methodological quality are needed to increase acceptance and promote collaboration between conventional and complementary medicine. 2. Financial burden for patients. Another issue is reimbursement by health insurance companies. In many countries, complementary therapies are not covered by statutory health insurance, meaning patients must pay the costs out of their own pockets. This can represent a significant financial burden for many people and limit access to these treatments. It is therefore important to find ways to reduce the costs of complementary therapies and improve their financial accessibility. This could be achieved by demonstrating cost-effectiveness and positive health outcomes, which could lead to better integration into the healthcare system in the long term. 3. Communication barriers between therapists. Feel torn between both approaches, which can compromise their treatment. Open and respectful communication between conventional medical practitioners and complementary therapists is therefore crucial to ensure holistic and coherent treatment. One way to overcome these communication barriers is to form interdisciplinary teams in which both conventional medicine and complementary therapists work together. Through regular case discussions and the exchange of information, both sides can learn from each other and ensure the best possible care for the patient. Training conventional medical practitioners on the principles and potential of complementary medicine, including bioresonance, could also help promote understanding and acceptance. Conversely, complementary therapists should also understand and respect conventional medical principles to facilitate collaboration. 4. Ensuring patient safety. Patient safety must always be the top priority, especially when combining different therapeutic approaches. Complementary therapies such as bioresonance should never be considered a substitute for necessary conventional medical treatments, especially in cases of serious or acute illnesses. Patients should always be fully informed about the limitations and possibilities of each therapy in order to make informed decisions about their treatment. It is important that therapists consider the patient's conventional medical treatment and ensure that there are no negative interactions between the different approaches. Monitoring the entire course of treatment by qualified professionals is essential to minimize potential risks and optimize the healing process. Conclusion. The integration of bioresonance and other complementary therapies into conventional medical treatment offers numerous opportunities, particularly through a holistic treatment approach that strengthens the body's self-healing powers and is individually tailored to the patient. However, challenges remain, particularly with regard to scientific evidence, funding, and communication between therapists. To fully realize the potential of complementary therapy, it is important to further advance research and education in this field. Furthermore, therapists from both disciplines should be willing to collaborate and learn from each other to provide the best possible care for patients. If these barriers are overcome, complementary therapy can make a valuable contribution to healthcare and support patient well-being in a variety of ways. Legal and ethical aspects. Bioresonance in the legal context. The legal status of bioresonance varies by country and region, as this form of therapy is often not recognized by conventional medicine. In some countries, bioresonance is considered alternative or complementary medicine, and its use is legally permitted when performed by qualified therapists. In the European Union, for example, Alternative practitioners and doctors are permitted to offer bioresonance as long as they meet the legal requirements. However, the legal responsibility lies largely with the therapist, who must ensure that the therapy is administered safely and correctly. In many countries, there are no specific laws directly regulating bioresonance therapy, creating legal gray areas. There are often concerns about the marketing and advertising of bioresonance devices and treatments, as some providers make claims of healing that are not scientifically proven. To avoid legal conflicts, therapists should be careful about the claims they make about the effectiveness of bioresonance and ensure they do not make unproven claims. Certifications and training. Because bioresonance therapy is a specialized method, thorough training for therapists is essential. Many countries offer specialized training programs and certifications for the use of bioresonance devices. These training courses are often offered by device manufacturers or independent institutions and provide therapists with both technical knowledge of the devices and the theoretical foundations of bioresonance. Certification ensures that the therapist is able to operate the device correctly, conduct therapy responsibly, and ensure patient safety. Patients are advised to seek out therapists with recognized certification to ensure treatment is delivered at a professional level. Some countries also have specific requirements for alternative practitioners and doctors who offer bioresonance, and regular continuing education may be required to maintain certification. Ethical considerations in bioresonance therapy. Ethical considerations play an important role in bioresonance therapy, especially since it is a complementary and not always scientifically recognized method. Therapists must handle the limitations of the therapy responsibly and avoid offering false hope or unproven promises of healing. Transparency towards the patient is crucial, including providing information about the nature of bioresonance and its scientific status. Another ethical aspect concerns informed consent. Patients should be fully informed about the effects, risks, and limitations of bioresonance before deciding to undergo this therapy. Therapists must ensure that patients understand the treatment and that they consent freely and without pressure. Furthermore, therapists should not use bioresonance as a substitute for necessary conventional medical treatments, but rather offer it as a complementary and supportive treatment to ensure the best possible care. Rights and ownership notice. This audiobook is published and distributed by Testbericht-Institut LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testbericht-Institut LLC. Testbericht-Institut LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testbericht-Institut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited.
Copyright Testbericht Dienststaat LLC. All rights reserved.